Whereas the week of April 21st, 28, 2007 has been declared National Infant Immunization Week to help ensure that children have all the vaccines by the age of 2. Now, therefore, I, and it says John David Franz, Mayor of the City of Hidalgo, Texas, do hereby proclaim April 21st to the 28th, 2007 as Infant Immunization Awareness Week in Hidalgo, Texas.
The significance of the Vaccination Week in the Americas is an effort that has been going on now for 5 years. It's region-wide, which means the whole hemisphere, all the 45 countries in the Americas, Canada, US, all the way down to Argentina and Chile. Significance is to build awareness of the importance of vaccination, not only of protecting people with vaccination, children, women, older adults, everyone really. There's vaccinations almost for everyone and for 14 diseases or more. The importance of an ounce of prevention being better than a pound of cure.
We have an amazing array of tools to protect people against disease and death, to protect children, families, and communities, and those are our vaccines. And we've made great strides, but there are still a large number of children, less than 2, who haven't received all the vaccinations that they need to protect themselves. And so this week is about working together with partners to talk about that, to let people know about the importance of vaccination, and that this is the best way to protect children, families, and communities.
We have a very dynamic border that the number of crossings along our border are huge. And so we no longer have a border that separates us, but we have a border that unites us. And because of that, health and illness in Mexico is health and illness in the United States, especially along the border.
Diseases know no borders. And so what we have to do is on both sides of the border work together to protect our children and families and communities so that because people come together, they'll all be protected.
We have many families, migrant families. They don't know that they can have their children vaccinated in the U.S. They don't have the record. They don't believe they can bring their record from Mexico and be valid here in the U.S. But what we have to tell that people is that they have the right to have their children vaccinated in either side of the border. Their record from Mexico is valid in the U.S. The health authorities in the Departments of Health at the U.S. side know exactly what means the record from Mexico and can translate it and make valid their vaccines from Mexico.
I think the national average for immunization is 80%. And here in Hidalgo County, we're at 78%. When you look to see that we're, if not the poorest, the second poorest area in the nation, 78% is not far from 80%. There are some other countries which are, have a more indigent population than we do that are much higher. Our goal for Hidalgo County, of course, is 100%. Our pragmatic goal is to reach 90%. And so even though I think we've done a pretty good job, I think there's certain room for improvement.
It's absolutely critical. And we, physicians in South Texas, have too often seen the devastation of not having children vaccinated. And yes, it is absolutely critical that those kids get that vaccine before the age of 2. There's a lot of factors that play into why we are not immunizing as much as we are. Part of it is just simply record keeping, but part of it is there's no time, missed opportunities, cost, travel to the provider. There's a lot of factors that come into play.
Hundreds of millions of people are outside their birth country for more than a year. So having those records, making sure, especially here on the U.S. border, but all over, people travel everywhere, making sure that they're up on their vaccinations and they know where to go and get the vaccination. So there's no fear that, there's other implications or that the vaccination could have a negative effect. That too is another issue. A lot of times because of ignorance or prejudice thinking, people don't get their vaccinations or don't bring their children in for the vaccinations, thinking that there might be a negative effect, which there's no evidence to that whatsoever.
There are a number of issues about why children aren't completely vaccinated, but I think probably the biggest one is that the vaccine schedule is very complicated. When I was a child, there weren't very many vaccines that people had to remember. Now, before a child turns 2, we want to vaccinate them against 14 diseases, and each of those requires more than one vaccine. So there's a lot for people to keep in mind. That's why we suggest that parents, as best they can, actually keep a record that they get from their doctor of their child's immunizations so that they can keep track, and that every time they go see the doctor, that they ask about immunizations, even if they think their child's up to date, to be sure there's not a new vaccine or a new opportunity to protect their children. It's something that no one can accomplish alone, so we really do need to inform everyone, and I think that's a really important partnership that you're talking about, parents and providers, because parents are the primary caregivers for their children. They want what's best for their children, and we need to make sure they know what are the things that they can do, and we need to make sure that providers know that talking to parents about immunizations is very important, and so that sort of cements that partnership when both are working together to protect children.
Sometimes in the political arenas, or perhaps in the sensationalism arenas, it's not a very exciting thing for a layperson in a community to be discussing immunizations or vaccinations. And so it's very important to have programs that raise that level of awareness, that make something that from far away appears to be routine and mundane, to elevate the awareness and understand that indeed it's dramatically important, that the impact has certainly significantly more effect on the health of the community than some of the most active treatments that are more exciting, like trauma or emergency work or HIV or what have you.
We're kicking out the National Infant Immunization Week and the Vaccination Week in the Americas here for the entire border, U.S.-Mexico border. So we have a big event here right now. It is very important because we bring the attention of the media, of course, and of the public health authorities and many other local authorities. We bring the attention of them to recognize the importance of immunizations. And we put immunizations into a higher level at the political agenda.
So we need resources. Not only do we need this to be on the agenda, on everybody's agenda, it's through that resources get designated and allocated for the public health workforce to do their job. And Texas and the border in general has a 20% less of a public health workforce than the national average. So it's a greater challenge, and it's important to strengthen that.
Valiente, valiente.
It's been a long 7 years without.
There you go. Con más ganas.
I think most people think of immunizations as a childhood event, and once you do the initial series, then it's done. But immunizations is lifelong.
One of the things we've noticed recently is that through our immunization programs and vaccination programs, we are seeing in a lot of these childhood diseases being able to emerge in adolescents and adults. For example, pertussis, or what we call whooping cough, is very common in babies and in children and infants. However, we're seeing those numbers increase in adolescents and even adults. So therefore, this preventative measure by taking the vaccinations and immunization programs throughout the state is key, and continuing the vaccination program through adolescence and even into adulthood will guarantee that you'll be of sound health. So this is a key factor that we need to introduce to the community, that immunization doesn't start or doesn't stop in your childhood. It continues through your adolescence and adulthood.
One challenge that we have is that we've done such a good job in defeating these diseases that many people don't see them, haven't had the familiarity with them. This year in Texas, actually, there were some teenage deaths from influenza. Very unusual, but when something like that happens, it calls attention to the fact that we need to use the tools we have to protect children. We need to make sure that we're taking advantage of them.
Have diseases that really, for all practical purposes, do not exist anymore. Millions of people died from smallpox in the past. Millions of people died from measles. Many, many children were involved with congenital or through these diseases brought by their mom. I don't know the numbers offhand, but I think 2005 there was one tetanus case. There were, of course, 0 smallpox cases. There has not been a smallpox case in many, many years. And I think there was something like around 15, if that many, of measles. So these are diseases that are going away. And so the impact is dramatic. And as you say, in this case, an ounce of prevention is worth a ton of cure.
It certainly is a time to celebrate the successes and reflect on what we've been doing, but also we need to look forward to what's going to happen after this week is over. Hopefully it's a jump start or a booster, so to speak, for healthcare providers and public health and all the partners to think about what they're going to do for the next 50 weeks.
This isn't something that people just need to do once. And every day, 11,000 babies are born in the United States. So no matter how well we've done, every day there's more work to be done.
This is just 1 week on the year, but what we try to do is to leave the message in the community for them to take advantage of this information throughout the year. Because vaccination is not just a one-time thing, it has to be continuous.
I think that a goal that we have is to look forward to a day when no children suffers or dies from a disease that's preventable by vaccination. And I think working together with parents and providers, public health, cross-border work, organizations like PAHO and CDC and the Mexican-U.S. Border Commission, I think we can make a big difference, and we can make sure that we're going to see that day for children and their communities.
What is important to note, and the point that I'd like to make, is that at least in the Americas and at least in North America, we have every resource available to have every child and every adult to be immunized, and that we have resources that I believe are not being utilized to its maximum. And I think through public education, and I think through the policymakers and their decisions, that we can reach that goal of having everyone vaccinated. If you vaccinate an entire community against a disease, guess what? Within a generation, that disease doesn't exist anymore.